Hey SmartPak fans, I'm SmartPaker Dan. She's Dr. Lydia Gray, SmartPak staff veterinarian and medical director, and we're here to answer horse health questions asked and voted on by you. Now last month, you might have noticed we had a different person sitting next to me. We were joined by Dr. Andy Kenneps, and he answered all of our joint health questions in honor of...
Did a great job.
He did a fantastic job. Yeah. So that's part of our Joint Health Awareness Month, and he is just a wealth of knowledge.
I love him.
He's great. So if you haven't checked out that episode, I would definitely go back and look at that one.
And he's funny too.
He definitely has a sense of humor for sure. But we are super happy to have you back.
Me too.
Did you have a good holiday?
I did.
Did you anything good?
Maybe.
That'll be another episode. But I'm sure you are super excited to get back and answer questions.
Yeah.
So while you're gone, though, we did get an update from our December episode.
Oh, okay.
Do you remember your question about strangles?
Yes, yes.
So Pete and Barkley submitted that question on YouTube and actually gave us a follow-up.
Oh, nice.
So they said, thank you so much for answering my questions. Pete is 110% better.
Woohoo!
And has even been bucking, running, and playing.
Nice.
So great job. Yeah. If any of you have any other follow-ups about your horses, please feel free to reach out. We would love to hear them. And of course, pictures are always welcome. Mm-hmm. So you ready to get back into it?
Let's do it.
All right. So question number 1. This was asked by Matt on Ask the Vet forum at smartpak.com/askthevetquestions.
Okay.
So Matt was wondering if there's a common signs that horses display when they are too warm in their blankets. Often people tend to blanket their horse based on perception of how they feel in current temperatures. I have 2 horses that are ideal weight in moderately thin coats. I realize this may vary from each individual horse.
Yeah.
So this one actually did bring up a lot of comments on our YouTube channel as well. So apparently it's a hot topic.
Okay.
So Elizabeth wants to know, or said, I hate being hot. I take my jacket off when I need to, and my horse can't.
Yeah.
Great point. And then Janelle said, I don't want my horse to be sweating in the winter because of me. We all have that guilt.
Yeah, the great point.
And then Penelope said, I don't want my horse to sweat in the middle of winter. That could be bad. Also a great point.
Okay, so lots of concern about horses overheating.
Yes.
Yeah, which is great. And I'm going to answer the question first, and then I want to share some fascinating research out of Norway. If you've not heard this, you will be floored.
See, I knew you'd come back with all the good stuff.
Yeah. So, unfortunately, there's not like a really great way to tell if your horse is too hot to his blanket, other than the obvious sweating. Sometimes I tell, when I get to the barn, before I take the blanket off to groom or whatever, I'll stick my hand up and feel how warm it feels up in there. And when I take it off, if the hair is super flat, then I'm thinking he maybe didn't need as heavy a blanket as it had on. Because the opposite is, how do you tell if your horse is too cold? I think we should cover it even though they didn't ask. Is if your horse is shivering is like the last resort. Their muscles are capable of shivering to create heat. Their hairs stand up. The fluff is sort of the everyday term. Piloerection is the scientific term, and that creates like an air layer between the skin and the outside and keeps them warm. So that's how I tell if a horse is cold. They also will have heat-seeking behavior. They'll go inside if they can, like in a shelter, in a stall. They'll stand on the sunny side of things. They'll avoid the wind, those sorts of things. Yeah. We let our horses at our place, because they have runouts, choose whether they want to be outside or inside, and that tells us if they're hot or cold. So sort of the place that your horse picks to stand tells you if they're hot or cold. However, if you're from Norway, they did a study where they spent 2 weeks, and they only needed 2 times or 5 minutes, but they spent 2 weeks teaching horses how to communicate with their handlers whether they were too hot, too cold, or just right.
No way.
And what they did was they had white signs on a fence at like horse head height, and one sign had a black horizontal mark, that was the too cold. One sign had a black vertical mark, and that was the too hot. And then one sign had nothing, and it was blank, and that was I'm just right, leave me alone.
Okay.
So they taught the horses that when you're too hot, touch the too hot sign, and I will come take your blanket off or change it. When you're too cold, touch the too cold sign, and I will put a blanket on you. And what they had to do was not treat the horses for randomly touching a sign. That wasn't the exercise. So they taught them when you're, like they purposely made them sweat under their blankets, and then taught them touch the hot sign and I'll make your life better.
Wow.
Yeah, so the horses learned it super quick. And then it was cold and it was rainy and windy, which is the worst conditions for horses, and they didn't have anything on, and so the horses correctly touched the I'm cold, put the blanket on, and so they rewarded him.
I feel like my horse would just go back and forth between the two just to see me take his blanket on and off as a game throughout the day.
I think mine might too. But they said these horses would line up at their respective signs when the people like drove in the road.
That is so
They
cool.
wanted to communicate with the humans so badly about what they wanted clothes-wise. Can you imagine the other things they want to communicate with us about?
I can only see the training that's going to be happening in people's barns after this video.
So check that study out.
So if we see the hair is like standing up, that's the horse trying to warm itself up,
Yep.
so you might need to blanket up.
Yep.
If you take the blanket off and the hair is now laying flat, that could also be
Or they're sweating.
Or they're sweating.
Yeah.
Also a potential sign that maybe they're too blanketed.
Yeah, and times that you want to consider your horse needs a blanket are when it's wet, rainy, snowy, icy, and windy. Wet and wind are the forces of nature that horses don't deal with very well. So they either need shelter, a place to get out of it, or covering. So.
Well, what I also like that Matt mentioned was that this may vary on individual horses.
Correct.
So I think some people are like, oh, it's X degrees, I'm going to throw this blanket on.
And also where you live. So if you live in Florida and it gets, oh my gosh, 40, then everybody gets their heavy blankets with their neck things on and their heads are covered and their tails are covered. And 40 where we live is like, woo, summer. So getting used to the climate where you live is important too. It takes 21 days for horses to acclimatize. So if you move, take that into consideration.
So if you're going down to Florida for the winter to show and compete, it might take your horse a little bit of time to
Or
adjust to that.
you moved during in the winter from Florida to say Minnesota. That's going to take your horse a while to get used to it.
Which would be a tough move.
Yeah.
Awesome. Well, hopefully that was helpful for you guys as we're getting into the dead of winter right now. So let us know if you guys have any other questions about that. So on to question number 2. Okay. This was submitted by Noah Jones on YouTube. And she wants to know, what is the difference between negative and positive reinforcement? I think this could be an interesting topic for your next video. Well, a lot of people have agreed, and that's why I got here. And we also had another comment on YouTube, on the community comment.
It's like people watch our videos.
It's like people watch them. So from That Short Equestrian, which love the name, by the way, it's currently a large topic in the horse community, and it would be nice to see both sides of the argument. Ooh.
And, after doing my research, because I'm going to say this, I'm not a behaviorist, I'm not board certified in it, and I'm not a trainer, I'd be a veterinarian. It's not as much that there's an argument as that there is some confusion on the part of the humans about what this all means. So I printed it out, and you'll forgive me if I read it because I do not want to mess this up. It's really important. And even with it in writing, I'm probably going to talk myself in circles and get confused again, so bear with me. But so this is operant conditioning, or trial and error learning, and there's reinforcement, or rewarding, and then there's punishment. And all that means is reinforcement is doing anything that increases the likelihood of the desirable behavior recurring.
Okay.
Okay, so punishment then is doing anything that decreases the likelihood of the particular behavior recurring.
Okay.
So that's not what we think of as punishment. We think of punishment as hitting or yelling or whatever. That's kind of not what behaviorists use. That's not how they define punishment. So that's the first problem we have to sort of overcome.
So there's reinforcement, and then within that, there's positive and negative.
Yeah, so each reinforcement and punishment then can have positive and negative for both. And those words mean exactly, literally what they're defined as. Positive means adding, and negative means taking away. So if you say positive reinforcement, it means adding something that the animal wants, a reward, so that the behavior you desire recurs.
Okay.
So an example would be this comes to mind first, having a dog sit and then give a treat.
Okay, rewarding for the behavior that
The behavior that you want. So you want to condition, reinforce that behavior, you reward it.
Giving him something for doing the right thing.
I think we all get that. All right, now negative reinforcement. This is one people don't get. This is removing something bad. and thereby increasing the likelihood that a behavior will occur.
Okay.
So my example is, no one fall off your stool, the whole way we ride horses is removal of a stimulus, and then the behavior happens. So we add, say, leg pressure or rein pressure, and then when the horse responds, we take it away.
Oh, okay.
That's negative reinforcement. You're like, negative reinforcement is terrible. No, it's a legitimate training tool.
See, I do something when I ride where the horse I ride is very lazy. He's an Appaloosa stock horse. But there's one part of the arena that he is very afraid of, which I think we've all had that horse where that side of the arena always has some monster on it.
Boogity.
Exactly. So
scientific word.
So we'll trot and like canter on one side of the arena, and then we get to that scary part is when I'll ask him to walk because he's lazy, so he likes to have.
I love it.
Yeah.
Yes, exactly.
Okay.
That is a tried and true training technique.
I thought that was like positive reinforcement because I was letting him, but that's actually kind of negative because I'm taking away.
I have to read the definition. You're taking away, so that what you're taking away aversive is the work.
Yes.
You're taking away the work at a play. You're trying to reinforce the behavior that you want to recur by taking away something that he doesn't like.
Yes.
That's exactly it. Dan gets it. Okay, so let's move on to punishment. So as a reminder, this is anything that decreases the likelihood that a behavior will recur.
Okay.
Positive punishment is, as we said, positive is adding and negative is taken away. Okay. Positive punishment, adding something aversive or bad to decrease the likelihood that a behavior will recur. And the example that I wrote down was when a horse bites you, smack in the nose. Okay, you're adding something aversive in the hopes that that bad behavior biting will not recur.
I think we all know that one.
Positive punishment is the one that people, as a community, we don't think works the best. Everybody agrees. Negative punishment, removing something the animal wants to decrease the likelihood of behavior will recur. Now think about this. Here's an example. You know those horses that maul you for treats, they snuff your pockets and stuff? If you reinforce that behavior by giving them a treat, they're just going to do it more. However, if you either ignore them or you can reframe, now here's where it gets confusing. Reframe it from negative punishment to positive reinforcement by saying, go stand over there and even look away from me. That behavior is going to get you a treat.
Okay, so
you've changed the story now.
So another horse that I work with.
My goodness, Dan, you're a trainer.
So when I open the door to give him his hay, he likes to like stick his head out and try to grab the hay right off the bat. I don't give it to him until he like backs up and moves his head away, and then I give him the hay. So would that fall under, by that definition, negative punishment?
Well, you've taken what could have been negative punishment, you've reframed it to positive reinforcement.
I always try to go positive.
The behaviorists say the positive reinforcement, even when the animal is offering a behavior that is undesirable, and you reframe it to say, how about we substitute that moving away from the mounting block, whatever the behavior is, for something good, standing still to mounting block, and then rewarding it. You find a behavior that you want and you reward it. That seems to stick better and conceptually make sense better than the other methods.
Yes.
So you'll clearly need to read on your own about this, but we've begun the dialogue. So
it is for sure an interesting topic, it can be very in depth and can go any direction with it. But
so it's all about consequences and timing. So we humans are not very good at it. Animals are very good at it. And there's a saying that every time you work your horse, you've heard this, you're either training or untraining.
Right? George Morris quote there?
It's George Morris's trainer, Gordon Wright.
Oh, I did not know that.
Yeah, a little something for everybody.
Okay, all right. Well, hopefully that helps you guys out in your training. Keep us posted with how that works out for you all.
Yeah, love to hear more comments too.
Yes, absolutely. So let's get on to question number 3. This was submitted by Grace Hiramoto on YouTube. So Grace wants to know, I wonder if SmartPak in general, not specifically Ask the Vet, could do a full 101 video. For example, when to do what, i.e. vaccinations, farrier work, and wellness on a foal. This also, of course, got a lot of questions and comments.
We don't even need to be here.
Anytime you mention foals, it's always going to bring in a lot of comments. So from Breakfast Foods, which also a fantastic name.
I love that.
I've been interested in becoming a vet, so I've always loved to learn new information about foals. And then Lauren said, I just want to see cute babies. Lauren,
Baby horses, especially like miniature baby horses, baby donkeys. Maybe the videographer will put a baby donkey picture in.
Oh, I think we could find a baby donkey photo. But anything about baby foals, I agree with, and I agree that we should absolutely do a Foals 101 video.
Okay, all right.
And
so this will be our start, and we'll kind of gather up the information from this and then move on. So
I was kind of hoping there was going to be a foal waiting in here when we came in today.
Oh, sorry, so sorry. So Foals 101, gosh, this is a huge, huge topic and might take more than one video. So I put everything together and I'm trying to condense it down to what we can cover in 3 minutes here. I think of foals as sort of before they're on the ground, so mare care, and then the first 30 days or so of the foal's life, up to weaning, and then life of the weanling.
Okay.
You know, so those discrete segments all have special veterinary medical or preventive wellness care needs and nutrition and everything. So I guess the first piece of advice is, or what I would include in a Foal 101 video is, make sure your mare care is up to date. So that includes vaccinations and deworming, because the mare's health influences the foal's health. That first milk, the colostrum, what the scientists or the veterinarian would say, the passive transfer of maternal immunity or immunoglobulins is really important, and that comes from having your mare vaccinated against common diseases early.
Okay, so make sure mother is in good health.
And that she's at a good weight. I mean, if she's thin or fat, then she's either not going to make a healthy baby or be able to feed a healthy baby or have foal out well. Yeah. So you want to have a good a 5-ish body condition score. And I'll say this so I don't forget it, is if you're breeding a mare or you've got a young horse, you've got to have your veterinarian involved. There are so many pieces of parts. Like, for example, when the mare foals, the veterinarian needs to come out within the first 12 to 24 hours and do a wellness foal care. Whether you see a problem or not, the vet needs to evaluate that foal for did he or she stand up? Is the nursing going on? Is the cognition all there? Is there a heart murmur? Do the eyes look good? Is there a patent urachus, umbilical? I mean, there's so many things to look at. You need an expert who can quickly do a physical exam and make sure that everything is okay. As an owner, your job is to, make sure the foal has, and continues to have, because things change quickly, straight legs. They're standing completely on their hoof. They're nursing, they're sleeping, they're running, they're doing all good baby horse things or baby donkey things. There's so many things that can go wrong that if your foal is not doing those things, then contact your vet. Obviously, this is like the last topic, behavior. You need to do a lot of reading if you're going to have breed a mare, have a foal, have a young horse, because there's a lot to know. I don't want to get into specifics as far as when you should do what, but I did read on a farrier's website that I trust. He likes to be out there looking at horse feet and legs and trimming on them at the first month, so 30 days. And he likes to come every 30 days. Okay. To make sure that things are progressing correctly, because there could be, angular limb deformities, flexural limb deformities, contracted tendons, that if they're handled early, you can, if you're on top of them, you can make them the horse can end up having a useful, productive life and be healthy and sound without surgical intervention.
So the farrier likes to come out early to do any foundational work on the feet that could be impacting any of the upper limbs.
And examine them. This farrier said, I like to watch the foal walk and make sure they're landing heel to toe and the legs carrying straight and there's nothing funky going on. So this guy stays on top of it. She asked, I think, about vaccinations and deworming. There are protocols. Your veterinarian will help you develop the protocol that is right for you, because it differs. Was the mare vaccinated ahead of time or not? That's a huge difference. Where you live geographically, the foal's risk of exposure to certain diseases, the type and brand of vaccine you use, it's all that depends on what vaccines are given when and which intervals. Because with foals, or the first time a horse gets a vaccine, you don't give just one. One's a booster. We have to start the series of 1, 2, or 3. Okay. Yeah. So, and nutrition, it's important to feed the foal right early. When to begin creep feeding, what do you creep feed with? Having the foals body condition score of 5 is important because they get too heavy or they get too much sugar in their diet, and then you run into developmental orthopedic disease and other problems. Boy, there's a lot of stuff.
There's a lot.
There's a lot. There's a lot.
So a lot of it sounds like one, your own horse's condition, the mare's condition, then the foal's condition. When it's born, if there's any sort of deformities or things that have to be addressed.
No normal.
Yep.
And then when to call the vet for abnormal, but your veterinarian will need also to make assessments. We don't wait that first 12 to 24 hours. You get the vet out and make sure things are okay, because things might look good to you that are not on track, and you want to jump on them early.
Okay, and especially work with your vet closely for finding out all those other vaccinations and things of that nature, depending on your area and your horse's health. So, well, if you guys have any other questions about foals, and make sure to send them our way. And if you have any photos, please send them. You can send them directly to me. It's okay. What?
Baby donkeys.
Oh, and baby donkeys. We're into all of that. And I will definitely get working on that Foals 101 for you. So question number 4 was actually asked by Katie on Ask the Vet forum. And Katie wants to know, what are your thoughts on adding aloe as a supplement for horses with a history of ulcers? If not aloe, what do you recommend? My sweet mimic had them about a year ago, and I just want to make sure he continues to heal and stay comfortable. And she said, thank you for all that you do.
Oh.
That's very sweet.
Wait, is there a public comment for this one?
There is no comment, no.
Okay, I thought I'd check before I launched into it. So
I love that she says sweet mimic, though, for horses.
I know,
that's
a great name. That's a great name. We like aloe as an ingredient for horses that need some gastric support. In fact, we like it so much, we put it in our SmartGuard Ultra, and that's the supplement that has that great research out of LSU. Dr. Andrews, who did that research, he pointed out some things. The effects of aloe vera are likely due to the synergistic actions of the 75 known ingredients found in the plant leaf. And it's the clear mucilaginous gel inside that leaf where all the good bits are. The good bits, as we call them, are still being elucidated or scientifically isolated and then scientifically studied to find out what they are. Some of them aren't even named yet. We're putting them into categories like we found antioxidants, we found cytoprotectants, that's things that protect the cell from damage. And you can understand why that would be helpful in a ulcer situation. So aloe is one of the ingredients that's been around for, centuries, and humans have used it for a long, long time. So its use of recorded history is phenomenal, and it's also one of the ingredients that has a ton of research supporting its use. And so we put in our product along with licorice. I could almost say the same thing about that. We have calcium and magnesium because of their ability to buffer the acids. There's glutamine, which is an amino acid that is important when cells are rebuilding, and that's going on as the lining is being replaced during healing. Glutamine as an amino acid just supports normal healing. So you need that. You need extra amounts of that. Sea buckthorn has some great research in horses. So we have looked at all the research and found these ingredients and put them into our formula. So we obviously think aloe is a great substance, and I highly recommend its use. But I like to include the other ingredients that we have. There's so many others I didn't mention, the collagen and silica, that make our formula sort of it's also synergistic. It has a well-rounded effect.
Okay, so aloe is a component of gastric health.
It is, and aloe itself has many components.
And as you were mentioning with people, they use it all the time. Like if you get a sunburn or something like that, you'll see a lot of people
you can use it even topically.
So kind of think of the same thing like in the horse's stomach if they're having some sort of inflammation or something of that nature going on.
There's probably something in aloe that supports a normal inflammatory response. Yeah, we know there are antioxidants in there for sure. Yeah.
Well, we're all about aloe here.
We're all about aloe.
We do have it in the pellets, but we also do sell it in liquid form as well. So would that just be something you'd like top dress
your
horse's grain with?
Yep. If you want to go with straight aloe, then we have that product. If you want to use aloe that's combined with other ingredients that have research too and support of their use, you can choose that route.
Well, if you do want to check out that Smart Gut Ultra research study that Dr. Gray was speaking of, that Dr. Frank Andrews did for us, you can actually check that out on our product page, on the Smart Gut Ultra product page. It's definitely worth the read to go over with your trainer and your vet and see if that's something that works for you guys. Well, on to question number 5. So this was submitted by HBC Equestrian on YouTube. And they said, my horse is a 13-year-old quarter horse, and I'm planning on breeding her in the next couple of years. How do I know if she is ready for breeding? What steps should I take with my vet to get my horse ready? It sounds like HBC and Grace should have a conversation.
I know. Well, it's spring, and everyone's,
Thinking
mind
babies.
turns to babies. Yeah. So, but this question gives me the chance to use one of my favorite big words.
Oh yes, I love when you say big words. Okay.
Theriogenology. Have you heard that before? No? Okay.
It didn't come up most of my dinner conversations.
It does. So it just means it's the branch of veterinary medicine that is about reproduction.
Okay.
So the experts in the expert veterinarians who study mare and stallion health are called theriogenologists. So I'm sure that word will be on your screen. So what this person needs, what this person needs, and I'm so glad she's thinking proactively, is a breeding soundness exam. And a breeding soundness exam, like there's physical exams, there's pre-purchase exams. This one has a very specific need, and it's to make sure that the mare is healthy and can carry a foal, can conceive, and then carry a foal to term. And so the breeding soundness exam starts with a physical exam because they want to look for things about the mare that could make it hard for her to either conceive or carry that foal. Maybe it's conformation problems, maybe it's another health problem. What if she has Cushing's? Is that a mare that should be then bred? There's a point, one expert I contacted said he feels it necessary to point out genetic defects in the horse, but it's not the veterinarian's purview to say, don't breed the horse. It's just, I want to make sure you know about this. And
have all the information.
Have all the information, still your decision. So, but that's part of a breeding soundness exam. And then the part that probably everyone thinks is the evaluation of the reproductive tract itself. And there's two components of that. There's the internal, which involves palpation, and probably nowadays with the use of ultrasound just to visualize structures. And then there's also an external examination. You want to look at the structures on the outside to make sure that they're in good shape too. One of the things we do in mares that aren't anatomically correct behind, I'm saying that as PC as I can, is a Caslick's procedure, where we sew the top of the vulva closed so that, gosh, I don't want to get.
You're too far right now. You gotta just go.
Oh well, if their vulva is laying so that fecal material can drop into it, you can see how that would be an unsanitary place to grow a baby. So there's a Caslick's procedure that closes that and makes it all nice and clean. There, I did it.
It wasn't so bad.
And then the third step of the breeding exam is probably want to take some samples while you're in there. And you can take endometrium is the lining of the uterus, a culture. You can also grab some cells for a cytology. But the most important thing is what's called an endometrial biopsy. So actually there's a long instrument with a little teeth at the end, and you take an actual sample of the uterus and send it to a lab. And then they tell you, is there inflammation, which is reversible, or is there scarring, which is not reversible? And the lab will grade the quality of the mare's uterus and tell you it looks great, give her a clean bill of health, should have no problems conceiving and carrying to term and foaling, or there's so much scarring, there's no place for the placenta to attach, and she's probably not going to be able to carry. And then I know the question is going to be, but why? So if a mare has a history of inflammation, then each one of those bouts is going to create some scar tissue, and so so then after time, and she's 13 after time, so she needs to have the talk with her vet and have a physical exam performed and internal and external evaluation and some testing.
Well, you mentioned the horse being 13. Is age also something to take into consideration, especially where it's going to be like the first breeding?
A teenage mare is not the youngest mare to carry a foal, but not the oldest either. So I would just, she's had 10 years to of cycling, and it'll be really interesting what that endometrial biopsy comes back with.
Okay, so as long as the vet signs off on the health condition.
Yeah, and it doesn't mean that you can't breed your mare if it comes back a grade 4, there's lots of scarring. It just means that don't get your hopes up, and you might spend a lot of money, and your mare might get bred, and she might lose it. So it kind of sets the expectations.
Lets you know what you're getting into beforehand.
Exactly, money-wise and time-wise and heartbreak, and hardship on the mare too.
If you do end up breeding your horse though, HBC, we want photos ASAP. Send us a couple through the whole journey of the pregnancy. We're into all of it.
Yeah.
Well, that was it for the questions for this month.
Cool.
These are some great ones, guys.
Oh man,
that's a
my
great way to
brain is smoking. Is there like smoke coming out?
Great way for you to come back and get started with this episode. But we do need your questions for our March episode. Ask your questions anytime on YouTube, Facebook, Instagram, Twitter, the SmartPak blog, and our forum at smartpak.com/askthevetquestions. Just make sure to use the hashtag AskTheVetVideo. Don't forget to check out our playlist and the Horse Health Library to see if your question's already been answered. If your question was answered in this video or in a previous one, make sure to reach out to us at CustomerCare at smartpak.com so you can claim your SmartPak gift card. So until next time, don't forget to subscribe and have a great ride.